but it's going to be very, very helpful to dive on something very minute and something very, very small that you can take also. So with this, I'll be saying good morning and how are you doing? And I hope you'll be having a very energizing conference today. Thank you for joining us for this very important section titled Ending Preventable Diseases and Pandemics, as we continue to reflect on how to build a healthier and more resilient world. This section brings timely insights to vaccine equity and global public health. So it is my pleasure to introduce to you our speaker, Kafuko. Zakaria is a molecular biochemist from Zambia and a Mandela Washington Fellow under the Young African Leaders Initiative at Arizona State University. He is an influential voice in the field of vaccine equity, ensuring that life-saving medical interventions are accessible, not just for the privileged few, but for everyone, especially those in low and middle-income countries. He currently serves as the director of One Day Africa, the African chapter of One Day Sona, a global non-profit that advocates for equitable vaccine distribution for the inclusion of developing nations in modern medical research. Zakaria has led high-level advocacy efforts, calling for mechanisms like the Pandemic Insurance Fund and coordinated surplus vaccine donations through platforms like COVAX. Please join me in giving a warm welcome to Zakaria.
Yeah, so not going to waste a lot of time, just to really get straight into the slide. So we're looking at ending preventable disease and pandemics, So I'm starting with this map. Some of you may recall this map from the COVID-19 pandemic, and that's what the distribution looked like. Moving on, some of you also may recall these statistics during the COVID-19 pandemic. Now, draw your attention to January 2021. So you can see there that the daily death toll was at 17,041. So meaning that every single day, 17,000 people were dying. Now, if you take a moment and think about what that actually means, you can begin to understand the scale of the problem that can be caused by infectious diseases or preventable diseases. The total number of people who died from COVID pandemic was over 7 million. Of course, this was a lower estimate because it is accepted that the total number is actually higher than this because some countries are not doing data reporting. So, why? We sum it up this way. If we are talking about any infectious or preventable diseases, number one, we have to enhance vaccine development and distribution. Number two, prioritizing the vaccine development for high-risk pathogens. And we can talk about what those high-risk pathogens are and what they look like. But the principle being that it's important for us to prioritize the vaccine development or therapeutic development towards high-risk pathogens, which sometimes the WHO calls pathogens of pandemic potential. And then the last point is on ensuring equitable access to vaccines. Then why are we having this discussion on the need to prevent or end infectious diseases as well as pandemics? Number one, there are specific gaps that have been identified, and we will talk about this later on. But the second reason is that there is a cost-effectiveness consideration to it. How much value do you get when you are preventing diseases as compared to how much you're spending when you have to treat and bury people, right? And then the other one is on economic returns, which can be worked back from the model of cost-effectiveness. So why does this matter. Number one, the current continental layout. So the way the African continent right now is laid out, given an example since West Africa, anyone who has a West African passport basically can just walk across any of the countries in the region, correct? Now, what does that mean if that one person is carrying a pathogen, an infectious agent? What does that mean in terms of ease of transmission or ease of spread? So this is why it's important for us to be thinking about this question based on how the continent is laid out. We have far easier access to countries around the continent than it has ever been, and it just keeps on improving. The other reason is on climate change, and I know that Akiki did touch on this from the previous presentation, but because of climate change, a lot of things that were not happening are now happening. Number one, if I may go a little bit into that, is the fact that some of the pathogens or organisms that were, secured in parts of the globe or parts of the earth have now started moving towards human population. Why? Because of the enabling climate that is beginning to evolve for those kind of organisms. Organisms that predominantly used to only inhabit very, very cold areas are now moving towards human populations because of the differences in the climate distribution. There is also industrialization as well as globalization. Now, I touched on globalization earlier when I was talking about the ease of movement for people. So when we think about globalization, if you think of a lot of infectious diseases nowadays, right? The window period for many of the infectious diseases is just a matter of days. Now, that was maybe a good safeguard if you think about, let's say, 50 or 70 years ago, when for you to move from Nigeria to go to Tanzania, you would have needed at least 1 month to travel, right? Whether by sea or connecting from train to train to train, 1 month, by which point, arguably, the pathogen you are carrying would have manifested, the symptoms would have come out, either you would have found treatment or the pathogen would have taken you out. But these days, because of the evolution of air travel, the person can move from Nigeria to Tanzania within less than 24 hours. Less than 24 hours. Now, even when you're thinking about things like Ebola, which requires about 72 hours at peak transmission, right? It means that 72 hours is enough for you to move from Nigeria to Tanzania before you even become symptomatic. So the risk continues to increase as we evolve our ability to interact with other populations quite easily. So it's important for us to continue discussing how and why we should be making pandemics. The other point is on identifying the current gaps. Now, there are gaps that currently exist that we should be thinking about if we're talking about ending infectious diseases and pandemics. Some of those are around industry and government gaps. To give an example, in industry, a lot of the big money which goes into medical research is reserved for pathogens which are considered to be money makers, right? There are diseases which are very, very profitable to invest in. So the big pharma companies or the industry puts money in those because they know that when they invest, they get a lot of returns. They make huge profits. And we can even find these articles online from what happened in the pandemic, right? So the incentive for looking at other infectious diseases is very low because they don't see a lot of profit. And the worst part is that a lot of incentive is lacking for African pathogens because Africa is a poor continent, let's face it. So even if we are dealing with infectious diseases in Africa, if a pharma company was to invest millions to try and develop vaccines for Africa, what profits are they going to make? That's a very good question for them to answer. So because of these kinds of considerations, it is becoming more and more observed that the big, really skilled and experienced companies are not going to spend a lot of money trying to fight diseases that are in a poor continent because the market is poor. And these diseases, unfortunately, are only in these poor countries, as it were. So the incentive is not existing. And the extension of this goes to government, and this relates to policy, or lack of policy thereof. There is a lack of incentive to allow for these companies, for example, to invest. So the lack of policy incentive make it difficult for these big companies to want to invest in the development of countermeasures for these diseases that are poor continent. And then moving forward, I don't know what's about the someone with the slide for please. Okay. Oops. Right. So what is the scale of the problem? If we're talking about ending infectious diseases or preventable diseases, the scale of the problem, number one, should be considered from the infectious disease distribution. Now, I touched on this when I was talking about incentives for pharma companies. But we, I think, are aware that if you think globally, not just African continent, globally, the majority of the remnants of infectious diseases are actually only remaining in this, the global south, as they say, right? And Africa being the big chunk of that. So many developed countries, many high-income countries have gotten rid of infectious diseases. Now, that is something for us to think about as we navigate this conversation. There are funding gaps, then there is gaps in infrastructure, as well as skills capacity, and obviously, if we're talking about ending pathogens or infectious diseases, then there is issues on biosecurity consideration, because medical research always comes with inherent risks in terms of biosecurity spillages or leakages, which have to be considered when you're making up these programs. But how exactly would we go about or start to go about working towards ending preventable diseases? Number one, always starts with detection and surveillance. So this means that we should be looking at setting up systems that can quickly identify the pathogens that are prevailing or that are circulating in the population, and not just identifying. We should even go further towards genomic sequencing. This has become more and more relevant as pathogens now are quickly mutating and evolving. So genomic sequencing becomes the very necessary part in terms of identifying the specific variant of a pathogen we're dealing with. Because even if you have a countermeasure like the therapeutic drug, if the pathogen evolves, then there's argument to be made that that therapeutic drug quickly becomes useless. So we need to keep up with the evolution of the pathogens that we're dealing with. And genomic sequencing gives us that capacity. So with genomic sequencing and detection and surveillance also comes the inherent need for the strengthening of the laboratory systems that we are using on the continent. The mRNA capacity. So for this one, I think a lot of us in this room are already aware of the development of mRNA or messenger RNA capacity in terms of both detecting pathogens as well as designing countermeasures. Now, the advantages of an mRNA-based platform for vaccine development, for example, is that these ones are very easy to modify, and because they're not whole organisms, they can be easily managed, even if there was, God forbid, a lab leak, right? These are portions of just the DNA, not the entire organism, which can cause disease once it lives. So there's a good argument in terms of trying to pursue mRNA capacities or laboratory systems that are running on mRNA as compared to whole organisms. And then regulatory strengthening, resilient supply chains, increased and improved research, as well as definitely public health advocacy. What are some of the current efforts and programs on both ending infectious disease and pandemic preparedness and prevention, along with the thoughts of equity? So the one I just mentioned on the mRNA Technology Transfer Program has been running, I think, for 3 years now. And this program specifically is setting up the setting up facilities in Africa which have mRNA capacity. So the first one was set up in South Africa, and then we've got 4 others that are set up, including Nigeria, Kenya, and 2 countries in North Africa. And then some mini labs which were set up by Pfizer and Moderna, and then we have now the creation of the African Medicines Agency, aimed at increasing the regulatory capacity and harmonizing the framework so that we have a systematic shortened approach towards regulating and approving medical countermeasures as a way of trying to save time. The pandemic accord, or the intergovernmental negotiating body process. So this came up after the pandemic and was meant specifically to create an agreement among all the countries in the world in terms of how we should respond in the next pandemic. Now, this accord has taken years to develop and to come to conclusion because there are just so many moving pieces to it, and every country has objectives. But as of 3 weeks ago, this accord has reached what we considered some kind of an agreement, a consensus. So we'll be seeing what ultimately plays out from there. And then the pandemic fund designed to create funding specifically for purchase of vaccines for poor countries in the event of a pandemic. And then the African Vaccines Regulatory Forum, this is meant to harmonize the way regulations for registration of finished pharmaceutical products is done, so that we save time, we save resources. And then there is the utilization of the controlled human infection model. Now, if anyone knows anything about one-day solar, this is something I think maybe that we are widely known for. During the pandemic, we were among, I think, the only organization in the entire world that was advocating for the use of challenge studies, as you may call them. So these basically are designed around, number one, increasing or accelerating the development of vaccines by using different approaches. And because these types of studies are under controlled environments, you can determine at what point exposure or inoculation takes place, and you can obtain data real time throughout the inoculation process, throughout the quarantine process. And you'll be able to generate your data in anything between 3 months but less than 6 months, compared to conventional field studies that sometimes can take even up to 2 years. So all this ideally allows to save time. And I think there is also the African Vaccine Manufacturing Forum, the Africa CDC Discovery and Development Research. Okay, I'll go to the next slide. And I think some of these that are mentioned here I already touched on earlier in terms of how to move forward. I think when talking about local businesses, but predominantly this slide here is looking at trying to ensure allocation of resources. So both the funding, the skills capacity, and infrastructure side of it. So all these points that are raised here are on trying to look into the issue of resources. So diversification, local philanthropy, reprioritizing, and things like that, South collaborations all around ensuring resources. So when resources are properly allocated, then we can work towards fighting infectious disease appropriately. Now, I wanted to just draw your attention a bit to this slide. I call it the shifting trend. So what I wanted you to observe perhaps from this slide is that when you look at the list of diseases, I don't know if you can see them here, you will notice that the red line which is going up is giving a comparison from the year 2000 and 2019. So look at the diseases which have a red line, basically diseases which have been increasing in the last 20 years or the previous 20 years. What are those diseases that have been increasing? So this is for the general age bracket for everybody, right? So you see that neonatal conditions, lower respiratory infections, diarrheal diseases, stroke, and heart disease, and the like. You continue going there. But what I'm very, very interested in is if you go to the age-specific consideration, look at this slide. So this one is for children between the ages of 1 month up to 59 months. So just about the 5-year mark. Look at the diseases which have been on the increase, right? Tuberculosis, as well as tuberculosis or coughing, as it were, which are connected towards respiratory diseases. Diarrheal diseases have remained the same, so has measles, right? But respiratory diseases have been increasing. Look at the other ones. Obviously, for children, you don't expect that HIV rates will be high, and you can continue to look at the trends which are going on. But let's get where it gets more interesting. Get to the core, this age group, right? Look at the trends. So from 2000 to 2019, look at the diseases that have been increasing. So diarrheal diseases are clearly on the rise. The rest of the two that are red lines are non-infectious, right? They are non-infectious, so they are not considered preventable infections. But I wanted us to look at this slide and see that there are gaps that need to be addressed. And when you go above this age bracket to 49, then you can see that there are trends that are showing the red line for also non-infectious kind of fatality causes, right? Now, what this means in summary is that we are actually not too bad away from where we want to be. The number of infectious diseases has been reducing in terms of impact. What is actually on the rise, if you look at those slides, is what are considered non-communicable diseases. So those ones have been on the rise. So we are actually making a lot of progress towards ending infectious diseases. The challenges remain, however, that insufficient political will to enable the right kind of policies, inadequate or lack of funding, and the sustainability of a very fragile medical ecosystem. So these are some of the big challenges that we are thinking about. And the pandemic fund is actually trying to put resources into trying to address some of these concerns, like setting up laboratory systems, ensuring that there is recruitment of adequate health workers, there is adequate detection and surveillance at all points of entry or movement so that we can quickly identify the pathogens and begin to mitigate the effects or deal with them. And then there are others there on infrastructure implications, brain drain and skills capacity gaps, pharma industry monopolies, I think we talked about this already, and vaccine hesitancy as well as product quality concerns. Now, on vaccine hesitancy, this one also has continued to play a big role in incentivizing the access to medical countermeasures of vaccines. There are people within our population that feel that they don't need to get a vaccine. And I think I don't need to go into details to explain this. You probably know someone already, just by me saying this. So this vaccine hesitancy has continued to contribute to the increase in infectious deaths, or at least has continued to delay our acquisition of the status of reduction of infectious or preventable diseases. But what does it actually mean when we are, remaining vaccine hesitancy in a population of so many people, right? I'll skip those slides, and I want to maybe just go to a slide I was trying to explain on. This slide. What does this mean? I want you to just pay close attention to the distribution of that picture which I got from the conversation. So, getting involved, I think you can read those points, but I wanted you to focus on that, the image. So when one person, for example, or in this case, a number of people decide they're not going to get vaccinated, as an example, to prevent an infectious disease, what does that mean? It means that even if one or two people in that population which is not vaccinated get an infectious disease, it means that that disease is going to spread to the entire population. That's what you see in the first slide of the image there. Right? The second portion of the image shows that, let's say that a very few number of people in the population are vaccinated, like the yellow people in this image. Right? Few are vaccinated. Then 2 out of the population get an infectious disease. What happens still? The rest of the population also gets infected. But in the third image there, or in the third part of the image, you see that if we have sufficient number of people who are vaccinated, represented by the yellow images there, it means that even if 2, the red ones, have an infectious disease, they will not infect the rest of the population. Now, this is the concept of herd immunity. What it means is that if we have enough people in a population that have immunity either from vaccination or post-exposure, then we are creating what we call as transmission buffers, meaning that even if one person or two people have the infectious disease, they cannot transmit it to the next because the people in their community are already immune. So the immune people act as barriers of transmission. So creating what we call as the herd immunity, thereby effectively rendering an infectious disease as non-threatening. So this is actually the approach we should be thinking about if we're talking about ending infectious diseases. And I wanted to make it maybe somewhat clear that when we talk about ending preventable disease, we're not saying that we get zero infections. That's a utopia we probably can't afford to live in. But what we should be thinking about is trying to get towards a place where the infections are so low that transmission is not a threat. And how do you people or people who are interested contribute towards this fight? How do we contribute? So one way is by getting involved in research. A lot of the discussions, a lot of the decisions that are made in public health are informed and should be informed by research. Now, I know that members of the EA community love research, and it should be like that. So the more research we do, the more we have an understanding both of the things we're dealing with and the approaches we should be using towards that. But also at an individual level, there are many opportunities that currently exist, from scholarships like the World Scholarship, the Mandela Washington Fellowship, the Chevening Scholarship, the Commonwealth Scholarship. These exist specifically around public health or global health and development. If you go online and look up these opportunities, you'll be able to find this, and you can venture into any of the fields within public health that takes your interest. And there is a delivery policy now with all of these funders and scholarship boards to try and get more people in the LMIC regions involved in this kind of research, involved in this kind of work. So it's up to you if you love this field or want to contribute. It's one way you can look for those opportunities. But also within organizations, including ours, we normally have volunteer opportunities and sometimes contracts, right? So if you want to contribute, let's say to the malaria campaign program, or you want to contribute to our CPO program, or basically our clinical research program, there are opportunities how and where you can contribute in this kind of conversation. And I'm pretty sure I'm out of time. All right, I'm stopping here. Thank you so much.
Please come here. And I should announce that in the campus section, it's going to be having an office now. So the office is going to be the support group for support. And if you want to answer that question. But there is a question in here, but before that, I think I have a question on the page. A lot of us will be very, very interested. You guys are supposed to there's a shift and I feel looking at public global space is a really major threat to ending pandemics. So the question would be how Africa, because I see that we have Africa, how do Africa represent for ending space pandemic?
Yeah, you're right to say that there has been a shift in terms of global foreign aid support, without mentioning specifics, but the idea is that this is perhaps an opportunity for us to strengthen those South collaboration. So within the continent, strengthen those collaboration. The second point is on ensuring that governments or health ministries create the right kind of incentives to allow for the pharma companies to invest in, and also perhaps, so companies to invest in creating the right kind of incentives. Then the other point also is on strengthening the involvement of local businesses. I think Africa has a lot of mining companies with so much wealth. If those mining companies are given incentives, for example, by government, to maybe contribute towards health programs, whether it is vaccination programs, whether it is research programs, I think that would begin to go a long way into addressing the problem within the continent without needing to go outside.
So the final question is it accurate to say all preventable?
Well, that's a good question. Are all diseases preventable? So I think infectious diseases, yes, are preventable. Infectious diseases by definition are preventable because all we need to do is create the mechanism that makes it difficult or impossible for pathogens to move from one host to another. I think the presentation on One Health was very relevant because right now we're living in a world where it's very easy for us to interact with animals in the environment that we live in. And animals, even wild animals, are getting closer to our habitats because we are also getting part of their habitats through industrialization, cutting new forests, building infrastructure. So we are getting more into the natural habitats of animals. So to answer the question, yes, all infectious diseases are preventable.
Thank you so much, and that will be it for the section. Please do join us at the podium for the service now.
Thank you.
Thank you.